Hi everyone, Dr. Carolyn here, and today I'm going to be talking about how to once and for all make peace with your body. Now, if you're dissatisfied with your body, you're not alone. And I wanted to tell you about a super interesting survey that was done by the magazine Good Housekeeping, in which they surveyed over 4,200 women. And 87% of those surveyed said that they had dieted at some point recently in order to change their size or shape. And only a paltry 6% of American women expressed that they were satisfied with their bodies. What was more astounding to me was that 14% of women said they would be willing to take 1 to 5 years off of their life if they could have their thin, ideal body. So giving up to 5 years of your life to have a thin body, that gives you pause, doesn't it? So other findings in the study included 60% of women said that how they feel about themselves was very highly influenced by their size and shape. 69% said that being in a larger body is not healthy. 74% had a list of good foods and bad foods that they were always referring to in their heads. And 11% would give up sex in exchange for their ideal body. Okay. While having self-doubts is, it's pretty normal. We all have them. I think what's really shocking is that, or really troubling, is that when your self-evaluation is primarily related to your superficial appearance, your size, your shape, that can lead to shame, negative self-talk, isolation, and a lot of suffering, as well as the use of extreme methods to try to reach that ever-elusive thin ideal. So my question is the goal of being thin and the time and energy it takes up in your life really the most important thing? Because that's what this survey is really saying to us. Furthermore, in the study by Good Housekeeping, 51% of women said that being thin or losing weight is a good way to be healthy. This is a hard belief to challenge because it confuses thinness with good health and fatness with bad health. And really, size is not the most important determinant of good health, but that's the bill of goods that we've been sold. For most people with food and body image issues, it's really easier to focus on the external appearance of the body, the way you look, rather than internal information, which is the most important factor for good health. So this outside in focus can cause a lot of pain, as you know, how you look is almost never good enough. And over time, by shifting from an external to an internal focus, you can reduce that negative self-talk and all of the judgments that we now experience in regard to body image. For example, good health is truly an inside out job. What makes you healthy has to do with how your internal body processes work, your metabolism, your digestion, your heart and lung functions. None of these internal processes are dependent on your being thin. A study by Janet Tomiyama, I think she's at UCSF, University of California, San Francisco, or Los Angeles, if I'm not mistaken, showed that weight stigma or weight shaming is actually bad for your health. And she was able to show that being exposed to weight shaming caused elevated levels of the stress hormone cortisol. And this led to higher deposition of belly fat and higher risk for heart disease and diabetes. So maybe that risk for diabetes and heart disease that's supposedly associated with weight is really more to do with what the weight stigma causes and how it affects our health. We unwittingly pass on these beliefs to our children, our nieces, our nephews, and other family members. just as many of the women I work with in the Anchor program have told me that they were put on their very first diet, whether it be at age 5 or 10 or 11, by a mother or an auntie or someone in their family. And, continuing to really focus on these exacting and unachievable standards for health, beauty, or self-worth is something that you can pass on, even if you're not trying to the next generation. And then that can then be passed on to the generation afterwards. So that's intergenerational transmission of the diet mentality and body hatred and food issues. While parents may feel that they're doing their kids a favor by trying to get them to lose weight, in fact, if you examine in your own life the impact that diet culture and diet mentality has had on you, you may realize how much yo-yo dieting, food obsessions, body dissatisfaction have all cost you. Why would it cost any less to your daughters? So I know that we don't want to pass this on to our children. So it's really important to take active measures to keep that from happening. Because while you're looking in the mirror and saying negative things about yourself, your children are listening. Or when you get infatuated with the next fad diet, lose weight, and then regain it all, your children are listening. Now, it is understandable that in our fat-phobic society, those in larger bodies would want to be thinner. From a social justice standpoint, living in a larger body in our diet-obsessed, fat-phobic society is a trial. It's brutal for many, many people. Everywhere you look, diet culture exhorts you to lose weight. The medical profession hammers you to lose weight. And as we know, the medical profession is the number 2 cause of weight stigma, with number 1 being family. So what is true is that most people who have struggled with food and body image issues most of their lives will probably not find a perfect diet or be able to reach their then ideal. So what can you do? Well, if you are able, and I know this is counterintuitive, but I keep hoping that if I say it enough, it'll start to sink in for everyone who's listening. If you're able to accept yourself just as you are, if you're able to allow yourself to feel valuable and worthy, no matter your size, if you're able to surround yourself with people who are supportive, no matter your size, including supportive people in the medical profession, wouldn't you be happier? Because what it gets down to is, what is your priority in life? Is it to be happy, productive, and healthy, or is it to be thin? And those really are the choices. It's either one or the other. You can't do both, because yo-yo dieting costs you in terms of your health. It can raise blood pressure. Dieting in general and weight stigma increase cortisol and risk for diabetes, and the list goes on. And I've talked about that in previous videos. The decision made from body hatred, any decision made from the point of view of I hate my body, is doomed to fail. Now, obviously, you choose. It's your body. And if you choose to change how you eat, to do so after you've come to at least some feeling of neutrality about your body. Don't do it because you hate your body. Whatever you do, spend the time and the therapy, whatever you need to learn to care about yourself, no matter your size. Take time to begin to see yourself as worthy and unique as you are, no matter your size, and take care of yourself, no matter your size. The first step towards greater satisfaction with your body is to stop seeing your body as a separate entity to be controlled and manipulated. Your relationship with your body is the very first relationship you ever have. We come into this world in this body. We leave this world in this same body. Your body is the longest lasting friend you have, and it performs miracles for you on a day-to-day basis without you even thinking about it. It's helped you survive illness, injury, surgeries, and other difficult times. It may have even helped you in the birth of a child. Your body may have also survived abuse, trauma, or substance use disorders. So, if we can just start looking at our bodies as a little more of an ally than an enemy. So Maya Angelou says, if you can't change something, change your attitude. And I love that. It seems that the most important accomplishment you can have, at least in my view, is to become the most authentic version of yourself that you can. To be able to become fully expressive, to not let your size or your food and body image issues keep you from expressing who you truly are and bringing that out into the world. What would it take for you to focus away from the number on the scale and instead to change your attitude and put your focus on expressing yourself to the fullest extent possible to the world? How would that change your life for the better? I hope this has been helpful, and I look forward to seeing you next time. We have coming up help. I'm stressed to the max and I can't stop eating. Hope you'll join me for that one. Thanks for listening.